I'm a dermatologist and I have been working for more than 30 years at the hospital, the Sint-Jan hospital in Brugge, and I have been working with many lasers, also with tattoo removal lasers. So this is why I got interested in tattoos. Tattoos have become very popular in the last decades, and nowadays more than 30% of the young adults have at least one tattoo. Some people even get addicted to these tattoos and cover whole limbs and even the entire body. This can result in beautiful pictures like you see here on the right-hand side. When looking at surveys, we notice that about 2/3 of the tattooed individuals report side effects. And these side effects can be mild and transient, but they can also be disturbing, permanent, even life-threatening, and leading to permanent damage. Let's have a look to the most important side effects and complications of tattooing. In the first weeks or days or weeks after the tattoo, in the wound healing phase, it usually concerns infections, which are mostly superficial and can be treated with topical antiseptics and antibiotics. But infections can also become invasive and can need systemic treatment, systemic antibiotic, and even hospitalization. Allergy is usually a late event. It occurs weeks, months, even years after getting tattooed. I will come back later on allergies. 20% of the individuals who have a tattoo regret to have a tattoo. And it's mainly these type of people who came and visited me and asked for advice. So we could give some advice about tattoo removal, but we had to explain to the people that tattoo removal is not evident. We have to use very specific devices, very specific lasers with different wavelengths for different tattoo colors. The removal itself, the laser treatment is painful. Can be very painful. It is tedious. It can take several sessions, up to 1 or even 2 years to get rid of a tattoo. And for multicolored tattoos, it's not always successful. On top, tattoo removal with lasers is quite expensive. If you look at both pictures here in this slide, you will notice that there is quite a big difference in hygiene. On the left-hand side, the tattooist is working in very good hygienic conditions. But if you see the tattooists working in the convention, you can notice if you look at the table at the bottom of the slide, you see this is not a very clean environment. So source of infection can be the site. It can also be the practitioner. The tattooist can carry, for example, methicillin-resistant staphylococci in his nose and spread this staphylococci in the wound of the tattoo. The customer himself can also have an infected skin lesion, and this infection can spread into the tattoo. And of course, the devices can be contaminated, the needles and the inks. So many microorganisms can be responsible for infections, and bacterial infections represent the majority of the skin infections, with common pathogens such as staphylococci and streptococci. When a tattooist uses tap water to dilute the ink, Pseudomonas can get involved. The ink can get contaminated by Pseudomonas, and the same can happen for atypical mycobacteria. And so clusters of infection have been traced because the tattooist diluted inks with tap water. Mycotic infections are extremely rare, and concerning viral infections, we know that viruses can be transferred by using contaminated materials such as tattoo needles, and also blood-borne diseases can be transmitted during the procedure. So what do we advise? We advise to have your tattoo in a hygienic situation by a tattooist who respects hygienic procedures, who respects good hand hygiene, uses gloves, and uses protective covers to protect the tattoo device. And it is also mandatory to use sterile needles and sterile grips. So what can dermatologists offer to the clients, to the patients? They can give medical advice concerning contraindications, skin diseases, preventive measures. We can give instructions for good aftercare and also treat side effects. And last but not least, many dermatologists have become experts in tattoo removal. Now, let's come back to contraindications. There are only a few absolute contraindications for tattooing. For example, pregnancy and breastfeeding. Why? Because tattoo inks are chemicals and they can contain some toxic ingredients which are absorbed in the body. And it is irresponsible to expose a fetus or a newborn to these toxic molecules. So absolute contraindication, pregnancy and breastfeeding. Also, people under influence of drugs or alcohol must not be tattooed. They must be sober. And last but not least, a very, very important advice from a dermatologist: never get a tattoo on a mole. Never. Tattooing on a mole is not done. Why? Because moles can change into melanoma, and these changes cannot be observed when a mole is tattooed. There are also a lot of relative contraindications for tattooing. Have a look at these pictures. At the left-hand side, you see scar sarcoidosis in a tattoo, in a fresh tattoo. Sarcoidosis is a systemic disease, often affecting the lungs, but sarcoidosis can also manifest in traumatized skin and in scars. And scar sarcoidosis in a tattoo can be a first manifestation of sarcoidosis. So it's important to recognize this. Sometimes a biopsy can be useful to prove the diagnosis. The right-hand side shows a patient with multiple tattoos and also psoriasis. Psoriasis is a very common skin disease. It affects 2% of the population. And what is particular for psoriasis? Psoriasis, when the disease is active, has a tendency to manifest in skin where skin is traumatized, where skin is injured. And here you see an example of a patient with psoriasis who got several tattoos and who developed psoriasis on his tattoos. We call this a Koebner phenomenon because Professor Koebner was the first person to describe this phenomenon, this isomorphic phenomenon. And Koebner effect can also occur in other skin diseases like lichen planus, Darier's disease in vitiligo, and as I already showed you, in sarcoidosis. So the message we want to give here is avoid tattooing during the active episode of these skin diseases. Can these people with psoriasis or lichen or vitiligo get a tattoo? Yes, they can get a tattoo, but only when the disease is under control. When the disease is in a sleeping phase, they can get a tattoo and preferentially do a test site, make a small tattoo in a covered site to see if there will be a reaction or not. There are also several other diseases which can be a relative contraindication for tattooing. All general conditions with impaired or disturbed immunity entail a higher risk of infection. So I think of diabetes, autoimmune diseases such as lupus, and also people taking immunosuppressive drugs, including oncologic medication, have a higher risk to have an infection in a tattoo. I call this relative contraindications. It means that these people can have a tattoo, but they need extra precautions to avoid infection and a very good aftercare. If there is any doubt, it's better to postpone the procedure and ask for medical advice. There are other relative contraindications, such we already mentioned sarcoidosis, also cardiac diseases. Cardiac valvular disease is a relative contraindication because these people have a risk to get endocarditis, and they sometimes it is advised to administer preventive penicillin before getting the tattoo. Inherited and acquired blood diseases and antithrombotic medication can lead to extensive or protracted bleeding. And pain during the tattoo can provoke epileptic attacks. So people with unstable epilepsy should be very careful to get a tattoo. So if there is doubt, better to postpone the procedure and ask for medical advice. Now let's come back to the problem of allergies. When a patient consults with a question about allergy, it is crucial to have a very good anamnesis and specify which type of allergy this patient has. When it's hay fever, it's not a problem. Hay fever is not a problem to get a tattoo. But when the patient has a latex allergy, this can be dangerous. And latex gloves, for example, must be avoided absolutely. The tattooist must use nitrile gloves. Also, rubber components in the devices can be dangerous and can provoke severe reactions in latex allergic patients. It is also good to document pre-existing allergies. For example, a person can be allergic to antiseptics or to ointments, to products which will be used for aftercare. If these products are used during or after tattooing, they can cause a flare-up of eczema, for example. So skin testing can be useful to identify pre-existing allergies. Is skin testing useful to detect allergic components of inks? No. What we know is that often red colorants are responsible for allergic reactions in tattoos. But we also know that the allergen which causes the allergic reaction is not present in the ink. The allergen is produced in the skin. The allergen is produced because the colorants are decomposed, are degraded in the skin, And this degradation process can be provoked, for example, by sunlight or by irradiation. So the allergen cannot be found into the ink bottle, and skin testing with the ink makes no sense because the test will be negative. So it has no use to do preventive skin testing with tattoo inks to avoid tattoo allergies because ink allergy is unpredictable. To get a better view on the cause of complications and to allow us to trace the culprit and identify a pathogen, it is very important that the tattooist records all the materials he has used. So every person, when a person visits a tattoo parlor, they have to fill in an informed consent form. And we recommend that this informed consent form, on this informed consent form, every product is registered, even if the tattoo has to be completed in further sessions. New inks have also to be registered on the consent form. It helps us to trace suspectable inks in case we have, for example, an infection. And culprit inks have been detected, for example, in Mycobacterium, atypical Mycobacterium infections, because the brand numbers were registered by the tattooists. Now, to summarize, to limit complications, it is very helpful to identify risk factors. So I summarized some risk factors on this slide here. If a person has an active skin disease, he has a higher risk of Koebner phenomenon. When this disease is under control, is stable, the person can get a tattoo. We know that high pigment density in a tattoo gives a higher risk of granuloma formation. It's also well known that tattooing will not eliminate scars. Tattooing can help to camouflage scars, but the textural changes in the scar will still be visible. So it can, a bad tattooing of a scar can lead to a poor aesthetic result. So people who want to camouflage scars have to look for a tattooist with a good professional tattooist with experience in camouflaging scars. Some colors like metallic colors, yellow, orange, also green organic pigment and titanium containing colors are often resistant to laser therapy. And people with experience in tattoo removal know that multicolored tattoos are often very difficult to eliminate completely. And as I already mentioned, red colors more often cause allergy in tattoos. When a tattoo is placed on thin areas with a thin subcutis, there is a higher risk of scarring. This is the case when tattoos are placed on articulations. As you already heard before, immune suppression has a higher risk of infection. Valvular heart disease, a higher risk of endocarditis. Antithrombotics and blood disorders can lead to extended bleeding and protracted bleeding. And sarcoid granulomas can occur in a person who has systemic sarcoidosis. I already mentioned that latex allergy can lead to severe allergic reactions, and contact allergy, for example, for antiseptics or aftercare products can give a flare-up of eczema after the procedure. What else can I advise? Good aftercare instructions can minimize the risk of infections and optimize wound healing. So we recommend to do all manipulations of a fresh tattoo with clean hands, to wear clean clothing, use fresh towels, and to avoid rubbing, wiping, picking crusts. Shower is allowed. Bath, sauna, and swimming pools have to be avoided until complete cicatrization of a tattoo. Sun protection is recommended not only in the first phase of healing, but also at long term, because we know that sun exposure and extensive sun exposure can induce degradation of the colorants, and it can also result in irregular pigmentation in the tattooed area. What can tattooists do to limit complications? They can play a crucial role in the prevention of health problems. First of all, they can limit regret by quality tattooing. They can do consult a checklist and do a good client selection and avoid to tattoo in a person who has a high risk of side effects. They have to use safe materials, certainly to limit infections and to limit toxic ingredients. And we advise to record all the materials they have used on the informed consent form. When a tattooist observes some health problems in his clients, it is advised that he reports these health problems to the government, to the authorities, because this can help to detect, to trace cluster infections. And last but not least, tattooists can also offer valuable help in skin cancer screening. I have already finished the big part of my talk, but I would like to give you some general advice for the public. When you absolutely want a tattoo, please get your tattoo in hygienic conditions with sterile and safe materials at a registered body art parlor, because it's controlled by the authorities, and look for a licensed and professional tattooist, because this will influence the quality of the tattoo. And in that, it's better to postpone the procedure and ask for medical advice. If there is a medical side effect, please consult the doctor. Don't wait, because it can lead to permanent scars. And last but not least, try to avoid regret. Decision to get a tattoo should be well informed and well reflected. What type of design to put, names, if your boyfriend or girlfriend is replaced by another person, remember, it's forever. Thank you for your attention. And if you want more information, you can visit the website of the European Academy of Dermatology. We have launched a tattoo campaign a few years ago, and the video cartoon of this campaign can be visited on the website. Thank you again for your attention, and if you have any questions, please go ahead.
I have a question. Can you do a question?
I hear you, yes.
Here, I am Juan Weilin from Brazil. I have some experience in patients with tattoo, that I went to one class about this subject, and the professor, he is telling us that these tattoos can induce energy alterations in the body. Did you know about this subject, about energy alterations inside the body inducing by the tattoo?
What we know is that the tattoo inks contain toxic ingredients. Not all inks, but some inks contain toxic ingredients, and they are absorbed in the body. They come first in the lymph nodes, and then they are spread in the body, and some of these products of these ingredients are eliminated, but some of these ingredients are stored in the body. So there is some concern about late events which could occur because of these toxic ingredients. For the moment, we have no proof that tattoos cause cancers, but we know that some ingredients are mutagenic and cancerogenic. So it needs a lot of observational studies of epidemiology to have more evidence about the relation between the ingredients in the inks and systemic diseases or cancer. Is this an answer to your question?
It is in the energy level. It's that's what want to mean. It's that it depends on the design that they are doing in the skin. They can provoke some energy alterations leading to symptoms such as pain in the site of the tattoo. And if you change the design of the figure, you can alter the energy in the body and leading to a cure of these pain symptoms. But this is another problem that I think it's not related to this kind of toxicity about the ink or the.
I'm not aware of this problem, but what we know is that there are metals in some inks, like iron metals, and they can interfere. For example, when a patient has to undergo magnetic resonance imaging, some examinations, and then there is an interference of the tattoo with this magnetic resonance examination. There can be interactions, but I can't answer your question. Your specific question, I have no good answer for this.
I know. Okay. Thank you very much.
You're welcome. Everything clear?
What can I do another? I want to do another question about how is the success when you need to take out the tattoo after the patient doesn't want any more tattoo. How you do?
You mean the result of the tattoo removal? You mean the result of the tattoo removal? Yeah. Let's say that for a simple black line tattoo removal is very easy. So for a name or a few letters or small figure, it can be treated with 2-3 sessions with laser and with a perfect result. Perfect result. When it concerns multicolor tattoo, especially with these difficult colors like blue or orange, it can happen that we need 20 treatments, and even after 20 treatments, the tattoo is not completely faded. The black will be gone, some reds will be gone, the green will be gone, but it can happen that there is purple left or blue left. And we always inform the patient, if it's a multicolored tattoo, that we cannot guarantee a complete success. So some people want to go on and to do the treatment. So we do the treatment with some reserve. And when there is only a mild color left and we cannot improve the situation anymore, then we advise to use some cover makeup. This gives the best aesthetic result. Not to cover with another tattoo, because if you cover with another tattoo, you can have a risk that colors interact, and that instead of a blue line, you have a gray line or a purple line. So difficult. Multicolored tattoos are quite difficult, but black tattoos, I had beautiful results. You couldn't detect where the tattoo was after the treatment.
Okay. Thank you.
Welcome.